Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. Today we begin a new theme of the gastrointestinal tract. This topic is close to my heart as a former emergency vet. With any patient with a GI history, it is really important to include information about the last meal, recent vomiting, if it was productive, and if there is abdominal pain. All of this is considered basic, but any medications or interventions are also valuable information. So let's get started. Today's case is a 10-year-old male-neuter domestic shorthair cat who has seemed lethargic and had intermittent vomiting for the past 2 weeks. He seems to be more distant than normal and has had no major medical history of note per the owner. A CBC reveals significant lymphocytosis, which appears as banded neutrophils on a blood smear. They performed both thoracic and abdominal radiography, but today we're going to focus on the abdomen. There is reduced central abdominal serosal contrast where we see a central soft tissue opacity that's closely associated with a gas-filled intestinal segment. We're going to come back to this. There's increased soft tissue opacity that's identified medial to the spleen that likely represents the left limb of the pancreas. In the left caudal peritoneal space, we see a smoothly marginated, thinly walled mineral structure that's consistent with a Bates body. The liver is a little enlarged, extending beyond the costal arch with a rounded margin. We also note that there's a little bit of fine fat stranding or soft tissue stranding amongst the fat. The gastric silhouette contains a small volume of gas. The duodenum is partially delineated, but not particularly well defined, but does extend towards this segment of intestine. Ultimately, we identify that it becomes a little bit more dorsal to this segment, and this segment is poorly defined with respect to its boundaries. We see that there's sort of a relatively thickened margin along the cranial ventral boundary. It's very difficult to identify thickening of intestine in general on radiographs because we can't really see the beginning of the lumen and the margin of the wall. However, we do get a sense here that there is a generalized mass effect. There is distinction of the lumen by both gas as well as accumulation of mineral material, and that the segment spans approximately 3 vertebral body lengths. On the ventrodorsal view, we see the accumulation of this mineral, and we see that there's kind of a little bit of a lobular margin to some of this portion of the central gas. Again, here we see that there's loss of distinction of sharply marginated or sharp fat opacity consistent with peritoneal fluid. And so we're going to conclude that there is the presence of a small intestinal mass with a gravel sign. And so that indicates that there is the potential for partial obstruction of the lumen. And our primary consideration is going to be given to an infiltrative process, specifically neoplasia. And our top 2 differentials are going to be lymphoma or gastrointestinal adenocarcinoma. We could consider infectious etiologies such as things like pythium. However, this is going to be dependent on endemic infectious processes in the region where this cat lives. We also identify that there is peritoneal effusion as well as the possibility for steatitis, which is inflamed fat. And this is likely secondary to inflammation associated with this mass. We do have to consider, because the mass indicates that there is abnormal tissue that's present, the possibility for perforation, as well as the possibility for concurrent pancreatitis. We have also identified that there is hepatomegaly, and this is a nonspecific finding which can be correlated potentially to whatever mass is present, such as round cell neoplasia, or could represent an independent process such as a hepatopathy or cholangiohepatitis. These substantive changes in the intestine can certainly account for the patient's apathy and recent vomiting. So because of this, the patient's age being relatively advanced, we are going to prioritize neoplasia. Our next steps would include tissue sampling. This can be performed with ultrasound guidance. The regional loss of contrast, like we had already discussed in our conclusions, could be regional inflammation. We could also sample some fluid and evaluate for fluid cytology. Of course, we would be concerned for the presence of intracellular bacteria, which could indicate a septic process or a septic peritonitis. Be sure to view the full report associated with this case. It will also cover the thoracic imaging. Thank you for listening, and remember, it's your case, so please post questions on social media.